is if anyone was contacted by, in the summer of 2021, we started a new process where we want to touch base with all of our program provider organizations here at WIHA, and just kind of like a mid-year check-in. And we didn't check in with everyone. What we did is we prioritized checking in with those program provider organizations that had not yet been able to offer a workshop, a WIHA workshop that they had indicated that they were trained in or wanted to offer, and just to kind of see, what the barriers are, how can we help assist those organizations, is there something that we can work towards with them, and just basically how can we help them assist and go forward in the rest of the year. With that, we received a good number of responses back. The majority of those responses were from organizations that are now no longer able to be active in the WIHA program. So I thought I would just share those responses back with everyone, just so we can kind of get an idea of what we're all dealing with when it comes to working after the pandemic or within the pandemic and all that stuff. So we did receive 44 responses from that survey. And really what the main barriers that we're hearing for not being able to provide programs is loss of leaders or lack of program leaders that are willing to do either virtual or telephone programming. Of course, common barriers that we're always hearing and we all are dealing with is, participant recruitment and marketing and things like that. But that was probably by and far the biggest barrier, as well as something that's also very common that we've always heard throughout the years is that I know a lot of you are dealing with time constraints, whether you're funded fully in health promotion or not, and how, dealing with those time constraints is also fairly difficult. So those weren't surprises, but dealing with the loss of leaders and lack of leaders is an increase. We're not used to that being a #1 barrier. So at WIHA, we're several things that we're doing on our side to help support you is obviously we're going back to the regular full year leader training schedule in 2022. So I want to remind you that that's all posted on our website, that the 2022 leader training schedule, and we're actually calling it facilitator training schedule now. We're shifting our wording a little bit to give more notice and more awareness to the fact that our leaders are really facilitators, which we all know they're facilitating group dynamics. And that's an important skill that our leaders and facilitators have. So that's why we've made that transition. So that is one way that we are working to assist you. We also sent, I think it was last week, sent out an update. So if you have not gotten this, please let me know and I will send it to you. Just a flyer template that you're welcome to use when you're recruiting volunteer leaders or even partners and program provider organizations within your community. We have right now, it says become a leader. It has some great graphics and things like that on that, but feel free to edit that. You can say facilitator if you want to. That is one resource that we've provided, but we're going to continue to work on that. So the one other option that if you have somebody that wants to be trained in any of the WIHA programs and the dates don't work out, on all of our programs this year, we have the option to click on a general interest. So if you're applying for a stepping on training and let's say you're only interested in in-person trainings and the virtuals aren't working for you or vice versa, or the dates don't work, obviously we hope that they do because it's really hard to organize these trainings, but we do have an option to click general interest. And we will at some point reach out to you when we have capacity to be able to offer another training to figure that out. So we want to make sure that nobody's falling through the cracks. And then of course, continual coaching, we're always available to talk with you about partnership building. We know a lot of your program provider partners in your communities have dropped off. Mainly, we know that healthcare and public health have had a significant drop off during the pandemic because of their COVID-related job responsibilities changing, dealing with emergency issues and things like that. So rebuilding partnerships, this is going to take time. It's almost kind of like we're starting from scratch. So we are here and we're working with you. We're patient and willing to do whatever we need to do to build back up our leader pool, our partner pool, and go forth and provide these really important programs in our communities. So that is kind of just an overall summary. If anybody wants any more details on that, I'm happy to send that out if you're curious as to what other people are dealing with. But that's pretty much the general overview. I do want to do a quick, so we are going to, at WIHA, we're looking into several grants for 2022 and beyond. One of those is to work with all of our program providers and partners in rural areas. We're really working on that, the rural health, health equity, underserved populations, things like that. One of them specifically dealing with what are those barriers, and we may be reaching out to you to do some focus groups and trying to figure out, because we're kind of starting from scratch when it comes to virtual programming and telephone programming, kind of like dealing with new programs. So we might be reaching out to try to figure out what those deeper barriers are and how we can really, really work together more than just a survey. So just know that hopefully we'll get that funding. We'll let you know, but either way, we're going to find a way to do it anyway. So expect that in 2022, probably more reaching out from us, and just know that it is not checking in. It's not a policing thing. It's definitely, you all are doing such important work and we really exist to support you. So that will be more to come. The other update I have on as far as getting feedback from you all is with the chronic disease self-management programs, which is living well with chronic conditions, healthy living with chronic pain, and healthy living with diabetes. Those programs have the option of doing telephone workshops. There's a mail toolkit that is used during those telephone workshops, but they're very underutilized. So if anybody has any insight that they would like to send me as far as barriers, or even if you want to type it in the chat box today as to what are the reasons why that modality is not being utilized, we're trying to understand that. We've seen some canceled workshops where there's only been a couple participants or a few participants, and so they've had to cancel either a virtual workshop or an in-person workshop. Those can easily be switched to telephone versions, because the telephone version you only have to have 3 to 5 participants, and you only need 1 leader to facilitate that. And it's only on the phone, it's a shorter curriculum, so it's super easy. So we can easily switch those and not have canceled classes, switch them to a telephone workshop, telephone version. So I'm trying to talk to people about that and figure out if there's a barrier there or if we shouldn't be promoting that. But please let me know. I think it looks, Lisa says that your leaders aren't interested, or they think that it's not going to get the flavor of a group. Okay. So yes, I hear that. However, we do have I've heard 4 success stories over the past couple months of telephone workshops that went over really well. 2 of them were very rural communities, and 2 of them one was in Dane and one was in Waukesha County. So really great things happening with those telephone workshops. So I'm encouraging you to utilize those if you're dealing with low numbers. That's a way that you can keep your leaders active and things like that. So I know it's just the CDSME programs, it's not all of them. So it's fairly limited, but I just wanted to bring that up. And please reach out to me if you have questions or anything about those telephone workshops. And it looks like Alyssa is saying too that she's hearing the same thing, that leaders decline to lead that version. Okay, so yeah, it'd be really helpful if we can get a little bit deeper into that. If you can, ask your leaders as to exactly why. Not that they have to do it, but it's just so we can understand better. Okay, so that is my update on the overall general providing programs during the pandemic. I did point out that the 2022 leader training schedule is on the website. Like I said, there's those general interest forms or general interest dates that you can click on. We also will be we're working really hard on developing some volunteer recruitment materials. We had an intern this summer work with Shannon on doing that. So we'll be getting those out to you as soon as they're polished and ready to go. And then I just want to remind you, for those 2022 leader trainings, it's really important that you get your leaders, that they can fill out the applications at least a month before the leader training starts. With this transition to virtual programming, we need at least a month to be able to print materials and mail those materials, as well as getting the leaders through the basic training that needs to happen for some of the programs. So please just know that we're coming up on the end of the year, and we've got training starting, I believe, in February. The first one is we've got a Living Well with Chronic Conditions one in February, and then several happening in the spring. So just wanted to remind everybody to do that at least a month ahead of time. That would be great. And then let's see, as far as curriculum updates, I'm going to turn it over to Shannon to talk about stepping on, because that's probably the biggest one. But then I will go and talk a little bit about some of the other program updates that are coming in 2022.
Yeah, I would actually say with some of our programs too, it's even better to get your individuals signed up for leader training before the month, because a lot of the trainings that we're the license holder for, so Stepping On, Mom, there'll be some other programs coming down the line that we need to have our roster set by that 1 month. And that includes them completing the basic training prior to that, because of the printing process and the mailing process of virtual trainings. You can almost imagine the process that our staff goes through leading up within that month time frame. So we really appreciate the early registration, so we can make sure that all the T's are crossed, the I's are dotted with the individuals that are wanting to attend those trainings. So as Jill had shared too, that we Stepping On, as I can imagine that most, if not all of you, have heard some some language around that, and you will be getting a lot more of a detailed kind of communication in the next 2 weeks or so before Thanksgiving about what's coming up. And I can share, yeah. So it's been quite the process, let me tell you. Well, it's been going on 3 years to kind of give you an idea. But anyways, we are going to be doing update trainings. So everybody that got certified this last year is eligible to take those update trainings, because we know that times are a little strange right now, and we just want to make sure that we're supporting you all in terms of keeping the leaders that you do have, or the facilitators that you do have, on board and active. So do let them know that that's also going to be communicated to them. I do want to share that there will be a fee associated with this, because with a new manual, WIHA cannot support the cost of all of those manuals. So we will be sharing what that fee is in that communication later on. We just have to get a better understanding of the number of pages, work with our printing, with Digicopy and getting that all set. So, but I do want to share that right now the facilitator update training is planned for about 4.5 hours. And this is merely for them to understand the changes that are happening. This is all done virtually as well. And it is going to be nationwide. So not all of the trainings are going to be able to accommodate 20 individuals. It just depends on how many master trainers we're able to have for each one. So if there are certain dates, to please have your facilitators filled out those applications right away, so we can get them into the one of their choice. It will also ask them for their primary choice and their secondary choice. So if they don't get into that primary, we can easily fill them into that secondary if that one is still available too. Also, just as a side note for all of our programs, is we've been getting some communication about canceled classes, and just making sure that you're having your facilitators reach out to the program leads about 2 weeks before their class if their class is not being filled. We want to make sure that we're helping and supporting your facilitators and your agency to have successful programming. And so we just want to put that message back out there, so then that way that's being heard as well. And then finally, some good news about Stepping On, kind of going back, is that for the new curriculum, what we're allowing is that if there is an in-person class happening, that guest experts, all except the exercise expert, are able to join virtually. So that means they can be projected both visually and sound. They do have to be live as well, but they can attend virtually into the in-person classes. The reason not being for the exercise person is because we do have a group, we do have to still maintain some level of safety when we're facilitating exercises, especially introducing them for the first couple of times, as well as the hands-on experience that we have throughout the programming. Yes, so just to clarify, yes, all of the facilitators who were recertified in 2021 will be eligible to take this update training. Okay. And then of course, if they were newly trained in 2021, they will also be eligible for the update trainings. Okay, I think it.
She's talking
Oh,
about
okay. Sorry, that was, yeah, that's for you, Jill. Sorry. But yes, if there's any questions, let me know. Just know that there's communication. Please share that with your facilitators. Make sure that you're helping them understand that they need to get signed up if they want to continue their active status. We did have a lot of kind of after facts where people would reach out about how they didn't get the communication, they didn't hear from their coordinator, whatever the case might have been. So just please help spread the word to your facilitators so we can get them updated and into the new curriculum. Hey, Jill, go ahead.
All right, thanks, Shannon. Okay, look, there's a question from Leslie. Do all the programs have an update training in 2022? No, so Stepping On is the biggest one. And then we will have a Healthy Living with Chronic Pain update in 2022, which that program's never been updated, so it's definitely due. And that one will likely happen in the first part of 2022 as well. We were supposed to happen in the fall, but then the national office, they had a fire. They're in California, so that's probably why. So anyway, so everything got pushed back quite a bit. And it looks like that should hopefully, we're fingers crossed, in February will be Healthy Living with Chronic Pain. It'll be very similar to what Shannon said with Stepping On, where it will be probably about 4 hours of an update training virtually, and there'll be a small fee just for the material costs and mailing. Okay, all right.
Yeah. And I'll answer Lisa's question about the peer leaders for Stepping On. So remember that the trained facilitators will have the responsibility to update peer leaders in the delivery that they will be helping with, whether it be virtual or in person. Yeah, and they'll get updated agendas for all of that to work through with their peer leaders.
Great, thanks. The last update we have is Stand Up, Move More, and I don't think, is Erin on? Is she on to describe this? Otherwise, I'll just give a quick summary for her. Okay, so our newest program, Stand Up, Move More, is now ready to be, yay, yes, Amy, thank you. Amy was one of our first pioneers of this program. So yeah, wonderful program. We're really excited that it's now ready to go. So several leader trainings are scheduled. Erin did want to announce that the fee for the leader trainings in January and February, oh, I'm sorry, February and March. So the February and March Stand Up, Move More leader trainings are now at a discounted price. So it's only at $100 per leader to get our facilitator. It's gonna take me a while to transition this wording, but it's now discounted, and then it's gonna go back up to $250 after that. So if you're thinking about Stand Up, Move More, we encourage you to get trained in the beginning of the year and save some money that way. And looks like Jody says it's a great program. She just finished up recently and was so great. So thank you. Yes, thank you too, Jody. Yeah, we've heard really great things about recruitment for the program as well. And so I know that Erin had presented at one of these before, so I won't take up too much time talking about it, but she is available to talk about details with you, and we highly encourage you to check that program out. As far as Angie, maybe if you want to say something about the funding status for Stand Up, Move More, yeah, I'll let you do that.
Sounds good. Yeah, I've had a few questions for Stand Up, Move More. As we know, there's the 5 criteria that have to be met. Right now, we are in the process of reviewing that. It has not gone through the NCOA process, but that only happens once a year. So the state has some flexibility. So as of right now, it is in SAMs under 23B, non-evidence-based, but you can use Title IIIB dollars for those, for that class, or if you have fund, with the special rates that WIHA is giving to with while they're in the research phase. So that's where that's at. But I do, anytime a program transitions from non-evidence-based to evidence-based, that goes out in the GWAAR digest. And I also will send an email separate to the health promotion coordinator list. So if you're not getting the digest, please reach out to Kim Cobb and get on that list, because I put something in there almost every week. So great.
Yeah.
Any more WIHA updates, or should I try to share my screen, which I'm a little afraid to do? But
I'll just say that I know that we've heard from you all a lot, as far as, I think even in this chat, about the programs that only require one leader to facilitate are easier. The cheaper, the more financially sustainable programs are, as far as the less amount of time at training fees and things like that. So Stand Up is definitely one of those programs that meets those qualifications. Only one leader is needed, and all that stuff. So we're hoping to bring more programs like that on board in the future.
Great. Well, I think I'm going to have to cut part of mine out due to my technical difficulties. So I'm going to change the agenda around just a little bit and go through some GWAAR updates, some questions that I've been getting. And then if I need to push AMP off into February, that will be fine, but I'll get through as much as I can. And also please use the chat, and that if you have any for WIHA, we'll be sure to get those to you and get your questions answered. So I'm going to go ahead and attempt to share my screen. Okay. Okay, can we see it? Yes. Okay, I'm not going to touch anything else on my screen, but some of the questions I've been getting over the past few months, one, the 3-year aging unit plans, as I had mentioned earlier, they were due November 5th. But if you're not sure what your health promotion goal is, if you're a health promotion coordinator, please reach out to your director. It's important to look at those as we go. I'm happy to sit and brainstorm with whoever it may be to help with ideas on how to accomplish those goals as well. So some of the SAMS reminders, best practice that we've found is immediately after your workshop to put the data into SAMS. And Carrie Kretz is wonderful at helping that. With that, we found if people wait until the end, it's not as fresh in your mind, and you may miss some data. So try to do that as soon as possible. I've had a lot of questions too. Is there a list that I can find? And encourage you to go out to the GWAAR website under Technical Assistance Health Promotion. I have a lot of documents out there that will probably be very helpful for you. One of those under evidence-based programs is a list of all of the current 23A, so it's the high-level evidence-based programs with a description. And that will be what you see as your drop-down when you go into SAMS or WellSky. There's also a 23B list, and that's where the Stand Up Move More is with the description. And I don't send out the document itself just because it changes frequently. So the most current one will always be out on the website. But if you have trouble finding that, let me know. My plan was to navigate through the website, but because of my computer issues, I'm not going to do that because I don't want to lose everyone. But please go out and look at that document. Another reminder is as you have new staff hired, I do a 1-hour overview of Title IIID. So aging unit directors, health promotion coordinators, if you have a staff member that maybe just enters data, or not just, that's a very important part of it, enters the data and you'd want them just to have this overview. It goes through provisions and priorities, Where do you find evidence-based programs? How do you enter those in? So I'm happy to do that with anyone. I just checked and I think I've done 24 sessions over the last year, which is up significantly from the year before. But that will also be recorded with the new ARPA information. So people can go out and view that. Again, once that is recorded and available, I will let everyone know through the GWAAR Digest that is available. And then the last update I have from GWAAR is the Healthy Ideas. Many of you have probably seen in the GWAAR Digest or participated in a webinar that I had last month. It's a one-on-one depression program that can be done, which is high-level evidence-based. As of right now, I only have 2 counties interested in training staff. Their training is designed where you have to have 20 individuals to do the training, and I don't know of any aging unit or ADRC that have 20 available staff for the training. So I was trying to coordinate something at the state level. So if you are interested, the recording of the program about Healthy Ideas is out on the website under Technical Assistance Health Promotion. It's about 45 minutes long. Or just send me an email if you want more information, or if you do want to get some staff trained in that one-on-one program. So I will stop right here to see if anyone has any questions about any of those items that I just talked about. It was a lot. I know you don't want to mess with your screen, Jill. Oh, the faces are.
It's all taken care of now. You're good.
Oh gosh, let me tell you. You would think this is my first time on Zoom. I do about 7 a day, but
It's all right.
Okay, I don't see any questions, but I'm gonna try to take you out so I can show you on the website. Talk amongst yourselves for 1 second.
Sure. Actually, one thing I forgot to bring up, I know I keep talking about these telephone workshops, so telephone versions today, but is just something to think about is having some of the toolkits, ordering some of those mailed toolkits on hand, like at the end of the year, if you're still needing to use up funds or whatever, so that if you have a class that you need to cancel because of low participants, you can easily switch it to a telephone version because you'll have those toolkits on hand already instead of having to order them and all that kind of stuff. So just one little tip that I wanted to throw out there, random.
Great, thank you. Can you see that okay? My screen is being shared, I think. Do you see the website or do you see the GWAAR updates?
The GWAAR updates.
Still GWAAR updates?
No, now it's the website.
Okay, yay. That's a win for today. Okay, so if you go to Technical Assistance Health Promotion, and then evidence-based programs, you'll see the evidence-based guidelines. So if you're looking, how does it become high-level evidence-based? You can see all the guidelines right there. This NCOA link to high-level evidence-based programs is the search engine. So you can go to NCOA, put in falls prevention, and it'll bring up all of the high-level evidence-based programs related to falls prevention. So Stepping On is in that. So you can use $3 on any of those programs listed on that search engine. And then this last document is probably the most requested one that people don't know is out there. It's Title 3D subsurface definitions for SAMs or WellSky. And this is the one that I don't send it out because it does change frequently. So I don't want anyone to have outdated information. I'm not sure if it's gonna come up. We'll see. I may be asking too much at this point. Jill, can you see it working on a Word document? Okay.
Yeah. It just looks like it's thinking.
Okay, you should see it now. Yes? Or no?
Not yet. Still looks like it's thinking.
It came up on mine. Okay.
Maybe because it took you to a new page, you might have to start sharing again.
But go ahead and check that out. It won't. It's saying I have, I think, too many things open now at this point. So if you look on this document, it'll bring up a Word document, and it has all of the current programs that are in WellSky or SAMs. So with their definitions. And just because if it's not on the list, that just means it hasn't been done in Wisconsin in about the last 3 years. So it can be added if it's on NCOA's list. If we put every possible program that was 3D eligible, it would be so long. And, you know, there's really about 12 programs that 80% of the aging units do. So we want to try to keep this just to what we know is happening in Wisconsin. And then I have all of our health promotion webinars here, so you can go listen to recorded webinars. Our last one was the ARPA funds, and we had Cindy Elfstead on. So if you want to go back and to listen to any of those with the notes, please check out this area. And then another really useful document, I think, is the Title 3D Frequently Asked Questions document. This one I also just keep out on the website because I add to it on a regular basis. So this is about 3.5 worth of years of questions that I've been getting that I, you know, I think with Title 3D, in particular with evidence-based health promotion, there's very unique situations that counties run across, especially with now virtual programming and how we track that and what's the best practices for those. So I encourage you to go out and read that and let me know if you have any questions or if you think any should be added, but that's just a good resource for you all. And I want to thank you all for giving me all those questions of the past 3 years. So we have that. We just added a question on using 3D dollars for a portion of the program. So an example would be living well, or we'll use powerful tools for caregivers. So you're implementing that program, you use some Title 3D funds for books, but you use other funding for staff time. So that other funding takes on the status of Title 3D. So the question was asked, if we're using other funding to pay the leaders, can we charge a fee for the class? And the answer is no, that's a voluntary contribution. So if you're using any Title 3D funding in a program, it has to take on those provisions and priorities. So I'll say that one more time because it was hard for me to follow the first couple times. So if you're doing a program and you're using multiple funding streams, if any of those funding streams are Title 3D, then the entire program takes on the provisions and priorities. And one of those provisions is that you can only have a voluntary contribution to that program. So even if you use other funding for the books, you can't charge a fee for the books. It has to be a voluntary contribution. So I'll pause there with any questions. But those are the types of questions that are out there in writing. So please feel free to go and take a look at those.
Angie, there's a question in the chat box from Jennifer. She says, I think that the definition was included in the GWAAR digest or GWAAR newsletter too. Is that correct? I think it was the 3D.
For the question I just asked?
No, for the highest. I think it was when you were talking about the highest level. Is that right, Jennifer?
Yeah, if you can clarify, Jennifer, that would be.
I was just, I know the definitions is something that we've been looking for in all of our older American Ed programs. And I was surprised to see that you did have the definitions for the subservices and such in SAM's in the GWAAR newsletter. So I first saw it there before I saw it on the GWAAR website. So that's all I was just pointed it out, that if people get Kim's GWAAR newsletter, they were also listed there.
Yeah, thanks, Jennifer. That's a great point. Yeah, anytime I put something new on the website, it also goes into the digest at least once or twice. And if it's really of high importance, like the AG Mastery program becoming high-level evidence-based, then I will send a separate email to all the health promotion coordinators and aging unit directors. So anyone where their contact, so everyone that attends the webinars would get those emails. But I try to put it in multiple sources. So I'm glad you saw it there, Jennifer. That's good to know.
And there's a question that popped in from Lisa. So if I understand correctly, if using 3D funds for any part of programming, we cannot charge, but can ask for a donation.
Yep, that's correct, Lisa. And if you want exact wording for that, because I know sometimes your fiscal folks need to see that, or directors, that is in the FAQ that's posted on the website. That's, I believe the first question we recently added. I see Lori said, are 3D funds also meant to be used for 60 plus if possible? 3D funds are only 60 plus. So it's Older Americans Act dollars. Okay, so I'm going to abandon completely AMP today and just call it a win that I didn't get kicked off. And so grateful for Jill Rankin right now for being kicked off earlier. So thank you for that. But I'm going to open it up for a few minutes for any questions that you have, or a program that's going really great that you want to share with the other counties.
Our Mind Over Matter attendance has been fabulous since we started in June. We've had 4 full classes, and we've got at least 8 on the waiting list for in-person in 2022. So that's really gone over well. I did put something in the chat that I would like to do something to recognize my 11 leaders, as 6 are new this year, but I don't know what I can do. I don't know that personally I can afford to get gifts for 11 people. And I don't think funding wise we can really use, and all I have is soon to be outdated Council on Aging thank yous, which I'll have to send to the Smithsonian at some point, I guess. So
yeah, if anyone wants to write in the chat things that they do to recognize their volunteer leaders, and I think that is the key, that just being recognized. I don't need, I don't think it needs to be anything monetary, but just that recognition of their time and effort, I have seen done. So. Yeah. And also with the Mind Over Matter, I have a lot of aging units reaching out saying, we're trying to switch it up, looking for something new for our community. That might be a great one to look into, since Rock County's having, I think a lot of counties are actually having a lot of success with Mind Over Matter. So if you're looking for a new one to give a try to, looks like Jody put, I'm doing an in-person mom workshop now and 8 individuals, which is great for up north. And a lot of folks in the rural areas are having trouble getting that, minimum number of participants. And I have been, I've had probably 6 or 7 counties reach out in the last few weeks, just wanting to brainstorm with me on, these are our resources that we have. These are our challenges. And can you recommend any programs? And we'll look at your community health needs assessment, and what are your concerns in the community, and what programs would match your resources and health needs. So if you're interested in doing that, just send me an email and I'm happy to meet with you and just talk through some things.
we actually did the Mind Over Matter also, and the first one we didn't have enough people register because we were doing it in person, but the second one we had 7, and
One of them actually was from another county. They couldn't get into the one, they were on quite a waiting list for that county. So it was really nice because it is a neighboring county. She was really excited that she could come to ours, and it worked out really well. It was interesting because all of the participants in that group said it would have been so much better to have 1-hour meetings for 6 weeks instead of the 2-hour meetings 3 times. They all felt like there's that loss of time. And even though you send out that thing in the mail that reminds them, they felt like the loss of that accountability and that group dynamic was really significant. Most had already participated in some other type of evidence-based program, and they really felt like the that weekly meeting was really important. So I have to admit, from my standpoint, because I was the leader for it, it wouldn't matter to me one way or another. I mean, the workshop is easy enough to facilitate, but I just wanted to share that in case it hadn't worked its way through the evaluations for WIHA yet.
Thanks, Leslie. I'll definitely take that back to Shannon, consider that as we do program updates like we do.
Great. Well, thank you
Even
all
if
for.
I was just going to say, even if it's an option, you know, sometimes we have those options, because I think it could be, you know, nice to basically, depending on what the dynamics are within your own county, to be able to offer it.
Yeah, it's surprising. We heard that with PALS too, the physical activity program. Once people stopped, once they had to or didn't have to attend, people said, we want to attend. We don't want to just talk on the phone. We want to see each other. So that's good to know.
Great. Well, thank you all for your feedback and your patience today. In February, we will have the Aging Mastery Program and also the Wisconsin Coalition to End Social Isolation and Loneliness. We'll have, they're doing a lot of really great things. And I noticed in the Aging Unit plans, a lot have goals around social isolation and loneliness. So I want to make sure that we do that in a timely manner. So please don't hesitate to reach out to me if you have any questions in the meantime. So happy holidays, everyone. I guess I won't see you until 2022. So thank you so much. And feel free to send me an email and let me know the types of things you want to see in this webinar as well. Thank you.
Thanks, Angie.